as you know already by now. And my special thanks to Dr. Rachel Bradnock for her significant contribution in this audit. So this is an audit on induction of labor for evaluating the outcome following second round of Prostin gel. So just to go with some background, this is the complete poster, but I have just split it in small parts just to make it a bit more visible. So, as we all know, pregnancy has to end with delivery at some point. So, normal delivery mechanism from 37 weeks up to 42 weeks, what we call like term pregnancy, and there is natural initiation of labor process, goes through labor and delivery. So, induction of labor is a process where initiation of uterine contractions before the onset of spontaneous labor, with or without membranes, which is a amniotic fluid sac which covers baby, after a period of viability for purpose of vaginal birth. So why it is indicated? Why do we go for that? So if there is any risk factor for further continuation of pregnancy, and that risk factor is either for the mother or for baby. Induction of labor is the most commonly performed obstetric procedure that is all over the world, and especially in UK, 1 in 5 labors in UK are induced. So common indications, as we said, that if there is any risk factor for further prolonging the pregnancy, either for mother, for baby. So the most common one is post-dated pregnancy, most common indication. And if maternal reasons, if there is any associated medical health conditions for mother, like diabetes, blood pressure. For baby, if there is any growth restriction for baby, if water bag has ruptured before time, which can further become the source of infection for baby, in such cases, we have to go ahead with the delivery. There are different methods. So methods are either medical method, surgical, and combined method. So for medical methods, we have certain medication, especially hormones, that is prostaglandin, misoprost, oxytocin, which is steroid receptor antagonist, and mifepristone. Surgical methods, there is rupture of bag of water. So there is a special like procedure where we do internal examination, go through the cervix, which is the neck of the womb, which is closed. But to go with surgical procedure, there needs to be some opening to go inside it, access the bag of water and hook it out. The hook, what is shown there, nowadays we don't use that hook. It is mostly the plastic kind of hook, which is not harmful for baby. The other method is there is a small double balloon catheter. I think my cursor is not seen there. There's a double balloon catheter called like Cook's balloon, and it works like a mechanical method. So we insert it inside the cervix and we fill it with normal saline, and it works like a pressure kind of thing, mechanical stretching on the cervix, and it is left there for 24 hours. If it works in 24 hours, if not, we are supposed to remove it back with risk of infection further. So what are the factors which can predictable for successful induction of labor? So the most important, because we are doing everything to open the cervix. So ripening of the cervix is the most important factor. So to assess the cervix, there is something which is called Bishop score. So cervix, it is like a funnel type of, it is normally it is closed. So when we examine it, there is certain criteria because it is like a fleshy thing to palpate. So when we do that internal vaginal examination to see the consistency, whether it is firm, soft, whether it has started opening, is it anterior, medium, or posterior, and where is the station of baby's head, if baby's head has started engaging down. So all this is the criteria which scores up to 13. So normal is if it is 6 and above, so that is good indicator that when we use any methods, it will be possibility that it will be more successful. Less than that means there is something is needed to ripen that cervix, and that is the medicines what we use. Most common one is prostaglandin. So prostaglandin, as just now I said, that if the cervix is a bit firm, we feel the criteria is still low, it needs some priming. So there we use prostaglandin. Oxytocin cannot work if still it is closed. It works mostly when we are able to open the bag of water, because that amniotic fluid itself, it contains the prostaglandin, which further stimulates contraction. So usually this prostaglandin significantly alters that Bishop score, that consistency and the softness of cervix within 24 hours. And it is the drug of choice in presence of unfavorable cervix. However, despite the effectiveness of this prostaglandin, it comes in gel form, it comes in tablet form, and it comes in a pessary form as well. So despite its effectiveness in cervical ripening, it is unsuccessful in inducing labor in some cases, in which is almost 30% of the cases. So when we do, let us take the example of Prostin gel and induction of labor first round. What is that round? That is one session where we can do the process at 6-hourly gap for 3 times. That is called like one circle, one round. And usually, if it is unsuccessful, then there are options. Either we can wait for 24 hours and go with the same Prostin gel for second round. If some opening is there, we can either open the bag of water or put that Cook's balloon inside. And the third option, which is nowadays I feel that becoming very common, to go for cesarean birth. Because what happens when women, they step in the hospital, if counseling is not proper, they start counting their time from that time. And suppose if they step into the hospital, some time for their arrangement, taking some rest, and then starting the procedure. So at the end of the first round, if still labor has not started off, so they think that, oh, I am here almost 2 days now, I'm not going to labor, so I want cesarean birth. So rather than counseling, if we directly go, yes, okay, if you want cesarean birth, we will go for it. But we know already surgical intervention at any point, it is not only that time is risky. In fact, in future also, we are adding risk more to their health, to baby's health, and to community as well. So appropriate counseling is very important. So in that way, we did this audit to see that suppose if we go for second round, what is the outcome? What is the success rate? And is it adding any risk factor or morbidity to mother or baby's health? Because it's something we are doing extra, whether it is at the cost of mother or baby's health. That was the aim of our audit. And this slide is dedicated to all mothers. So our aim was to evaluate the obstetric outcome of patients who received second round of Prostin gel for cervical ripening, together with assessing its efficacy and safety as well. So this was a retrospective study, and what we did, we collected data from our labor diary where women were admitted from July to September over the period of 3 months, 2022 year. Then we have an electronic system that is called BadgerNet. So after reviewing the labor diary, we went through the system to collect the information, and there we collected demographics together with indication and whether the second round of induction of labor was required, how many doses, timing of the gel was used, and after that, outcome what we studied were the progress of labor, what was the success rate, interval of the induction to birth, how long it took, mode of birth, and was there any maternal and neonatal morbidity. So total 502 women were admitted for induction of labor using first round. Out of that, 34 patients underwent induction of labor with second round. So from this 502, 34 went for second round, but there are a good number of patients who declined second round and opted to go for planned cesarean birth. We haven't included here those women. Out of these 34 who opted for second round, 6 women, after Having started the second round, they declined to continue further and went for again cesarean birth. 28 women, they completed the second round of induction of labor. So this is the pie chart of first round of induction of labor and then the second round. So what we have compared with first and second round, what was the spontaneous vaginal birth? So 59% after first round, 54% second round. Then assisted vaginal birth, where we use like instruments, either suction cup, which is vacuum, and or forceps. That is again 16% in first round, 14% in second round. Cesarean birth for abnormal fetal heart rate, for failure to progress. In first stage of labor, which we start from the dilatation of the cervix, it starts from 1, 2, 3, up to 10 centimeter. That is the first stage. And the second stage, after complete dilatation, which is 10 centimeter till delivery, that is second stage. So cesarean birth in these two. So if we see cesarean birth and instrumental delivery, not a big difference in first round and second round. And in first round, 59% spontaneous vaginal birth. In second round, 54%. So what does it tell? So we will think that, oh, it is the same. But the number of women who went for second round, if they don't go for it, they will go directly for planned cesarean birth. So if we don't go for second round, there's 100% cesarean birth. Now the duration, sorry, the graph and that is not completely matching because this is in hours and that is in days. So it is a bit, looks like a bit different. So 19 vaginal birth out of 34 patients. So 27% gave birth by third day. But this timing is included, this started from the first round of induction of labor altogether. So by third day, 58% by fourth day and remaining 15% between the fourth and fifth day. So that was the duration. But this duration again included the first round of induction of labor, which itself is more than 24 hours. Now, what this review demonstrated that the use of second round resulted in 68% of vaginal birth. Then unplanned cesarean birth. Now, how the 68% came? Because that 54% there in our pie chart, sorry, that was out of 34 patients. But from those 34 patients, in the middle of the continuation, 6 went for planned cesarean birth. They refused to continue. So this is out of 28 patients. Yeah. So 68% vaginal birth. Unplanned cesarean birth rate is 32% in second round, which is compared to 25% that was in first round. Instrumental vaginal birth is consistent. This practice does not appear to increase any maternal or neonatal morbidity like heavy blood loss or low Apgar score for babies at birth. That is the most important thing, because if we are doing some extra intervention, whether it is at the cost of mother's or baby's health. So our conclusion is a second round of Prostin gel is an effective and safe method and could be successfully used. This outcome enabled us to counsel women in our unit for the second round of induction of labor, which will further reduce cesarean birth rate due to unsuccessful first round. And we have started that. And by the end of this month, I will be doing the second audit just to complete this audit loop to see that how far now we have become successful in counseling women. So this is all the references, and I will conclude here my presentation with a big thank you and note for the day. Yes, one of our head of the department always he used to say, keep smiling, keep smiling. One day I found this quote and I told him, I said, sir, this is special now. What you tell us always, keep smiling. Just one small thing I would like to, our doctor who presented for the dementia, she's there? No. She left. Sorry for that. I don't know if she's there online. Just a small thing. I remembered one small thing. Like one time, one father, he asked his son, maybe most of us, we know that the story, that he asked his son about the timing. one time, two time, three time, four times. Then son gets like irritated that why are you asking me again and again? So he goes inside and he comes back with a small notebook and he has written there in his childhood, he has asked him to father 99 times, and 99 times father has answered that to his son that what is the time. So this nowadays we are with nuclear families, with our professional career orientation and all. We forget somewhere what our parents did do for us, because old age is same like childhood. So with more advancement in medical, we have become like very much medically oriented. So we just like, there are increased number of care homes, old age homes, and that's how all these things are building up, dementia and all. If we will think that what our parents, our grandparents, they have given us in our childhood, and if we think that same for them when they are in their old age, if we give them that same love and care, what way they gave us, so I think there will be less cases of all this dementia and care homes and robots and that much money investment there.